Chapter 6 is titled Aseptic Garbing, Hand Washing, and Gloving. In this chapter, we're going to talk about exactly the title, Aseptic Garbing, Hand Washing, and Gloving. So the objectives are to gain awareness of the connections between the early concepts of germ transmission and current procedures, understand the procedures for aseptic garbing, hand washing, and gloving according to the USP Chapter 797 guidelines, identify ways that aseptic garbing, hand washing, and gloving protect the patient from infection, and to recognize and respond appropriately to actions that compromise asepsis during aseptic garbing, hand washing, gloving, and gloving procedures. Demonstrate excellent technique in aseptic hand washing. So the final component of this chapter, after you've had an opportunity to practice, will be to have a proficiency process validation checkoff in lab. So garbing, hand washing, and gloving are important components of aseptic technique. Of course, aseptic without infection. They help avoid introduction of pathogens, which are disease-causing microorganisms, while working with sterile compounding products and supplies. The most common transmission of these pathogens is through touch contamination. However, there are some other components. To ensure that we have the most aseptic environment, we need to use proper techniques in assembling our garb and preparing to make those compounded sterile products. So maintaining asepsis is critical. Most of our patients are compromised. They're sick. Also, by giving intravenous medications, we are bypassing the body's primary protective mechanism against infection. So those products, it's very, very important that they are aseptic. Now, the whole concept of sepsis and asepsis, it goes back pretty much into the 1800s. Throughout history, there's been a little ebb and flow as to cleanliness and asepsis, but it wasn't until the 1800s when that really began to come into play. In the 1800s, if you read your chapter, it talks about Semmelweis, who was an obstetrician, who realized that by cleaning in between deliveries, mothers were less likely to contract infection, which potentially could kill them. So they had less mortality after delivery. And then also Florence Nightingale with cleanliness and treating injured patients who had been in war. And then later in the 1800s, Joseph Lister had the germ theory, which was built off of Louis Pasteur's idea of contamination. So with Lister, that brought about the gloving and garbing component, as well as disinfecting our skin or using antiseptics and disinfecting equipment. So currently, the USP 797 mandates that all sterile compounding personnel wear sterile disposable gloves when preparing compounded sterile products. Again, as I stated in the previous introduction, that's a best practice. Reality is some facilities do not always use sterile gloves, but it is a best practice. We will learn technique of the appropriate guideline of using sterile gloves, but we will also practice how to properly disinfect a non-sterile glove. Current sterile attire reduces incidence of nosocomial infection. So nosocomial is either other terms that mean that are hospital-acquired infection, hospital-borne infection, or healthcare-associated infection. Correct garbing, hand washing, and gloving are important safety measures in preparing sterile products. So before beginning, you have to complete a self-assessment. So basically you ask, okay, am I ready to do this? So what requires compliance? So you're going to assess your own physical appearance for any violations. So are you wearing any hairspray or perfumes or cosmetics? Do you have artificial nails or do you have on nail polish? If you answer yes to any of those, then you are not compliant. Make sure that you remove any jewelry, including any body piercings not covered by a gown or mask. That would be earrings, nose rings, any other facial piercings that wouldn't be covered. You want to keep your fingernails closely trimmed so that it's easier to clean underneath them to make sure that we don't have any bacteria. In the hand washing procedure, we actually will use a device to clean under our nails. We also need to make sure that we have no weeping sores, because those could actually absorb through some of the gowns that we would use. We don't want to have a sunburn. Generally, with a sunburn, your skin starts to get dry and may peel, so that could cause contaminants. A rash, again, could be scaly and slough cells, or you might itch. And also no respiratory infections, because airborne contaminants, viruses, or bacteria on coughing may occur. The use of the PPE, or personal protective equipment, is important with sterile compounding, and making sure that we put it on as aseptically as possible. We want to minimize the risk of contamination. In addition to donning the PPE, we must also perform an aseptic hand washing. The hand washing procedure is much more stringent than a basic hand wash. So in garbing, we're going to garb in the order of what we think of as the dirtiest to the cleanest. And in between each step, we also want to make sure that our hands are as clean as possible, not to cause further contamination. So the proper order is first your shoe covers, then your hair cover, then your face mask. Now, as you're watching your video, pay close attention to the proper procedure. So the foot and head guard. So first off, you should be wearing closed-toed, also closed-heeled shoes. We don't want to risk any injury from broken needles or broken glass or needles, dropping a syringe. You could spike your foot if you're not wearing the right kind of shoe. So either leather or some kind of grade polymer component. No canvas or cloth-like shoes should be worn. They should be clean and well-fitting. Walking or running shoes are safe as long as they're like leather. The best would be a nurse or even a restaurant type shoe. Something that's going to have good support, because when you're making IVs, you usually stand for an extended period of time in one place. So you've got to make sure that you have the right support in your shoes. Also, sterile compounders need to place disposable shoe covers over their shoes to keep the dirt and other substance from contaminating the clean room floor. In some facilities, you actually cannot wear your shoes outside of the ante-room area. You have to change your shoes coming and going and carry your shoes that you would wear for work. So once we've put on our foot covers, now before we even begin with putting on our shoe covers, we're going to sanitize our hands. Then we're going to put on our shoe covers. Then we're going to sanitize our hands again, and we're going to put on hair covers. So generally, these are referred to as bonnets or bouffant caps. It could be a washable surgical cap. Generally, we're going to use kind of if you think of them like lunchroom lady caps kind of thing to cover our hair. Now, depending on your hairstyle, you may need more than one cap to encompass all of your hair. After you put on your cap, we're going to sanitize our hands again, and then we're going to put on a mask. So the different kinds of masks may be one like the one pictured here, where it's got loops that will go over your ears, or you may need to tie it. If you're a man and you have facial hair, you may be required to wear a beard cover. All right, now it's time for some questions.